Hey, good morning, everybody. I'm just waiting for all of our spokespeople to join. Thanks for joining us this morning. All right. Looks like we're all here. So again, I'm Nicole with the Ochsner PR team. Thanks for joining us here this morning. I know most of you have been joining these media briefings over the last few weeks, but just setting some ground rules again. I know Katie is going and making sure you have recording permissions. I will go over some very familiar faces who will be our spokespeople again this morning. They'll give some updated data and information, and then of course we'll jump into the Q&A. So with that, just again, our spokespeople who you now know pretty well: Warner Thomas, our President and CEO, Dr. Robert Hurt, our Chief Medical Officer, Dr. Sandra Kemmerly, System Medical Director of Hospital Quality, and Dr. Catherine Baumgarten, Medical Director of Infection Control and Prevention. So with that, I will turn it over to Warner.
Good morning, everybody. Thanks for joining today. As we said, we would continue these briefings with you to continue to be transparent about what we're seeing happening during this fourth surge. Just to kind of set the table, kind of what we're seeing today. As of today, 890 hospitalized patients across the Ochsner system. That's a 73% increase from last week. So once again, 73% increase in 1 week. Our hospitalizations, still 90% are unvaccinated. So this, as we've said before, this has evolved to be a pandemic of the unvaccinated. And we have seen that hold true as we've seen escalation of the Delta variant across the region. In Baton Rouge, I'll just go through this briefly. In Baton Rouge, we have 81 COVID patients. In the Bayou, we have 94. In New Orleans, we have 328 COVID patients. Lafayette, 137. North Louisiana, which would include both Shreveport and Monroe, is 64. And our North Shore, including our partner hospitals on the North Shore, 186. So that's 890, up from 787 last week. Or excuse me, that's 890 up from, you can run the math, the 73% increase. So get asked a lot about positivity rate. We did almost 21,000 COVID tests this week, 19.75% positivity rate. As far as pediatric patients, we have 7 pediatric COVID patients in our system. The positivity rate for kids is actually a little higher, 24.5%. So that's a little bit of information there. On vaccines, we're close to eclipsing the 500,000 vaccines. We're at 491,000. We did vaccinate 1,200 employees last week. So that's a real positive sign. We're up to 67% of our employees having first doses. And once again, 62% are fully vaccinated. But as we do the second shots on the folks over the last week, we will be at 67% once those second shots are completed. As we announced, we are moving forward with the fact that our employees have a choice to be vaccinated, or the protocol will be they'll wear an N95 mask and be tested each week. We've been continuing to roll that out, and I do think that's one of the reasons that, coupled with the fact that we've seen such an escalation of cases, that you see the significant uptick from our employee base. As of yesterday, I'll check this number while we're on, but we had about 520 employees that were out on quarantine, which means they tested positive for COVID and have been quarantined. So that's kind of where we are. Robert, I don't know if you got, or Sandy or Kathy, I mean, that's just kind of the briefing on the numbers. We can certainly take questions, but Robert, I don't know if you got any other updates you want to give.
I would just add, along with the volumes that you talk about in our hospitals, I just want to impress on this group that this is leading to all of our emergency departments and our urgent cares being incredibly busy. And this makes the wait times longer. I think the other thing to impress on people is this does affect other people needing care. A lot of people are coming in for testing. In our EDs, we're trying to have other facilities, other places where testing can occur, but this is causing long waits, and it's also leading to the inability, as Warner's mentioned on other calls, to take transfers in from other places as our bed capacity becomes stretched. Those people that need some of the specialized care that we're able to provide in some of our facilities, certainly at OMC here on Jeff Highway, we can't take those patients. And so it is affecting the care that everyone is getting as we continue to get more staff involved, trying to minimize the amount of staff that's going out on quarantine. Again, just trying to protect everybody, staff and patients.
Yeah. And Robert, just to maybe a couple of factors on that. So at Jefferson Highway, we take about 50 transfers a day. And in the past 10 days, we've had to turn away 300 patients that needed to be transferred for a higher level of care. We just could not take them here. I know in Lafayette, they've had to close their orthopedic facility and to consolidate, staffing to their main Lafayette General Medical Center. At most of our hospitals in, New Orleans, North Shore, Baton Rouge, we've essentially, unless it's an emergency, we're not doing, other surgeries. At Ochsner Medical Center, we're down 60% in the number of surgeries that we're doing, at this campus. So it is impacting, lots of folks, and because really all of our resources and focus are on taking care of folks that are emergencies, in addition to the almost 900 COVID patients we have across the system. So as we told you about a week or so ago, this is going to keep escalating. We think it will escalate in the next, several weeks. The models that we've built internally that project this escalation project that we will continue to see an escalation in the coming weeks. So it is absolutely reaching a critical situation. We are looking at other ways to open bed capacity beyond our normal beds, and how we can monitor patients in a different way. So we're evolving those ideas. When we have them, we can certainly talk about them. But it is definitely escalating, as we've talked about previously. So Nicole, I don't know what we missed, if there's something you want us to dive deeper on before we go to Q&A.
I think that it's just not too late to get vaccinated. If y'all want to touch on that again.
Yeah, Sandy and Kathy, I mean, you guys are both infectious disease experts, so I'll let you guys give your plea on the vaccine side.
Yeah, so it's certainly not too late to get vaccinated. And we get a lot of questions about, well, I had COVID last year, so I don't need the vaccine. The vaccines protect against the Delta variant, and that's what we're really concerned about, and other variants that may appear later on down the line in people that are not vaccinated. So it's not too late to get vaccinated. And even if we start today, there's generally 2 shots, and you need, a couple of weeks of time after the second shot to have complete immunity. But one is good enough to start, and we encourage people to take both of them.
Just as an aside on that, and Sandy and Kathy, correct me if I'm wrong, but the original variant of this, going back a year and a half ago, I mean, those are all gone. I mean, we just don't even see that variant anymore. I mean, 90+% of all the cases we're seeing now are Delta. So if someone thinks they had immunity, it's to a strain of the virus that's not around anymore. It's not here. So they don't have immunity to the Delta variant, which is why they need to be vaccinated. And I just think a lot of people just do not understand this and understand how it works. So the more you can do to help educate them from a media perspective, I think that would certainly be helpful. So.
Warner, that's exactly true. We know that the variant of COVID now is all Delta at this point, 95% plus in our region. And, we don't know yet if there's going to be other variants that come to be. And the way to reduce this and the way to reduce risk of that happening is to still get vaccinated. And right now we need people to be at home, not in a hospital. And we know that 90% of those patients in our hospitals right now are unvaccinated. So, we have 160 patients at our largest facility at Jefferson Highway, 160 patients just with COVID. So that's 160 places that other non-COVID patients would be getting elective procedures, getting things done that they need to get done, not waiting in emergency rooms for beds. And that's significant. That puts a toll on us. That puts a toll on our hospital. It puts a toll on our staff. And our staff is already rolling their sleeves up, getting things done. I want to thank our healthcare workers for what they're doing. We've done this not one, not two, not three, but 4 times now. And it takes its toll. They're doing it. They're getting it done. We're getting patients taken care of. But certainly it's affecting not just us, but our community.
I would say if you thought folks were healthcare heroes last year in May and June when that was around, they're really heroes today, given what everyone has gone through. So a couple of questions out there. Emily had a question about a little bit more about the models. What are they showing? They're showing continued escalation of cases. We do not see any plateauing at this point in time on our models. We also, during the first surge last year, we set up essentially a symptom tracker where if people, test positive or call us up and have symptoms, we track them. Are they better or worse? If they're worse, we call them and make sure we get them in to see them. If they're better, then that's fine. But that symptom tracker, we have continued to see escalation in the number of cases of folks that are also testing positive, and we're monitoring them remotely. They don't need to be hospitalized, but that's been a very good indicator of hospitalization down the road, and that symptom tracker continues to escalate. So yes, we do think the cases will continue to escalate, and that is what we are seeing in our models. As far as where we're getting transfer requests from, we get transfer requests from all over Louisiana, Mississippi, the Gulf Coast, southern Alabama, the Panhandle of Florida. So it's really everywhere. And at this point, as I said, we've taken some transfers, but it's been very limited. And given the escalation that we're seeing, I think it will be even more challenging in the coming days. So, this idea of delaying care, so things that are scheduled that can be delayed, that is absolutely happening every single day now. Surgeries, procedures, it's happening every single day so that we can redeploy people into our hospitals and help take care of folks. So it is absolutely having an impact on others. And the escalation of patients we're seeing in our ERs, historically, we'd see, maybe 190 or 200 folks at Ochsner Medical Center. We're in the 300 or 300 plus. So it is absolutely a very challenging and ongoing situation. There's no end in sight at this point. Are we having trouble employing traveling nurses? Yes, we are. We are searching all over the country for people. And really we're offering what we have to offer to get folks to come. We've added significant additional financial incentives for the workers we have to continue to take more shifts and to compensate them for the very challenging situation that they're in. But frankly, it's hard to find traveling nurses given the escalation of cases in other markets. And once again, going back to March and April of last year, there was only a couple of hotspots in the country. So nurses traveled and they went to those few hotspots. Today, there's lots of hotspots and there's lots of demand for nursing. And look, there's shortages of nurses just in general, even take the pandemic out of it. So you layer the pandemic on top of that, and it's a very, very different situation. So, and remember, last March and April, all of the outpatient areas, all of the clinics, all that got shut down, and everybody was sheltering in place at home. We don't have that today. You know, folks are out and about, and that's good. But our outpatient clinics are open, our outpatient areas are open. Folks are out and about. They have other medical issues and conditions that come up. And so, we're in a very different position today than we were in Surge 1. And, we maxed out at about 1,050 patients in Surge 1, and we're, almost at 900 today. We added, Robert, 60 COVID patients overnight. So it is rapidly escalating.
Okay. Another question. We know demand for the vaccines is rising. Can you talk about whether that's leading to any changes in vaccine distribution, adding more places to get a shot, or having to have more vaccine on hand, or launching more mobile vax clinics?
Yes to all of those. We, obviously for a while with the vaccines low, we were having to meet that demand. Now that the demand has gone up, we've been able to ramp up the distribution around the system for the vaccines. The supply, though, keep in mind, doesn't seem to be an issue. We can continue to get vaccine. We just have to get it to the right place now that the demands are going up, which, trust me, we are not complaining about that. We want the demand to go up. We will get vaccine to those places where there's demand. We want to make sure we can continue to vaccinate people.
And I would say that I think it's different. Once again, so last year we did lots of testing, lots of drive-through testing, lots of different locations. And then as we got into vaccines, we redeployed some of the people from testing to vaccines. And now we really have demand in both, given this fourth surge. So we're really having to look at how we redeploy a lot of folks in our system and how we open up as many locations as we can. So yeah, that's definitely been a challenge. There's no doubt about it. There's a question about the 890. Yes, it's 890 COVID patients. I think we started the week with about 2,500 patients across our system. As I said, about now today 890 are COVID. So.
Okay. Another question. With continued escalation, at what threshold would you request crisis standards of care? How would that work?
Robert, I know you've been on the calls with the state around some of this, so I'll let you take that.
Yeah, so I think it's good to step back and realize that with crisis standards of care, that's not an individual hospital decision. We're having conversations with other hospitals across the regions as everyone continues to have their bed capacity be challenged and the staffing capacity challenged. But this will be something that we continue to communicate with the state on. But this will not be an individual Ochsner decision. This will be something that we will do if it ever came to that, in coordination with other facilities. And like I said, right now, we are still dialing back other services so that we can continue to manage to care for our COVID patients. But again, I think we got to remember that as the numbers escalate with COVID, we do have to continue to dial back some of our other services for other medical needs that people might have. And so this is problematic, but this will not be done in isolation, any type of decision about crisis standards of care.
Robert, there's a question about types of surgeries. I don't know if you can just give a couple of examples.
Yeah, so just for everybody, an emergency surgery, someone comes in with a bad gallbladder that's septic, that sort of, those surgeries are going to be done. The things that can be put off are going to be those larger surgeries that are not immediately pressing, that might need an overnight hospital stay. And again, this gets back to just not having the beds. But I think it is good to understand that these could be some type of cancer surgery that we may have to put off a week or two, that is always, from a medical standpoint, may not have any consequences, but as you can imagine, for a patient, certainly has psychological consequences of putting off a surgery like that. But emergent surgeries are going to happen. But some of those elective things we just have to push off, that don't have to be done immediately because of imminent health issues in the patient. So,
Robert, I believe last week we had a planned living donor transplant that, once again, that's a planned surgery with a living donor that we had to delay, I believe.
Absolutely. We had to put that off. And you can imagine the expectations that patient had, both the recipient and the donor had leading up to the surgery, and then to have to put that off. And so in the case of a kidney patient, or a kidney transplant patient, that's several more weeks perhaps of being on dialysis, which is a procedure and a process and a medical service that is not without its own complications of being on dialysis, week in and week out. So again, unfortunate circumstances happening.
Yeah. There's a question, Nicole, about respiratory therapists. I mean, it's the same issue with respiratory therapists as nurses. We need more. We are, looking at, agency and looking around the country. So yes, it's really both. So
yeah, just like Warner said, they're being pulled all over the country right now. It's not just a surge in one or two places. It's all over the country. And so, and they're traveling just like many of our nurses are to where those needs are. So we're trying to get as many in here as we can.
All right. A question, how much concern is there about the new Delta Plus strain of the virus? And what sets it apart from the original Delta variant in terms of outcomes for patients?
Sandy and Kathy, I would take that, but I think I'll let you guys take it, seeing how you're the infectious disease experts. So just a little levity this Thursday morning. So
Right. So the Delta Plus is the Delta with an additional mutation. And so what we do know with this Delta variant is far more contagious than the Alpha variant and the original strain. And so that is why it's spreading like wildfire in our communities. And so the vaccines are still effective against it. And what we're worried about from an infectious disease perspective is the next mutation of Delta or the next mutation of something else that's not affected by our vaccines. So I think it's very important, again, for people to get vaccinated. And we also are seeing where it was rare to see 20, 30, 40-year-olds in the hospital hospitalized with COVID, we're seeing more and more 20, 30, 40-year-olds hospitalized with COVID illness. And those are the groups that have lower rates of vaccination. So the illness and the vaccinations go hand in hand. And so again, it's not too late to get the word out that we need to vaccinate people as soon as we can.
All
there's a
right.
question about how difficult is it to redeploy surgical staff to ER and ICU. I mean, it's a challenge because obviously, frankly, there's some folks that don't want to be redeployed. And so we have to go through that challenge with folks. But yeah, I mean, it's, Robert, you can go into more detail, but it's absolutely a challenge. We have to talk folks through it. It is a different job. It's a different situation. So it just creates a lot of anxiety, a lot of stress. And frankly, folks that, signed up to work in the OR and be in surgical cases, I mean, they didn't necessarily sign up to be in other parts of the organization. We understand we're in a very different situation right now, but it is emotionally taxing for our team members that have to get redeployed, and it absolutely is a challenge to make sure we give them the right support so they can go there and do a great job. But Robert, I don't know if you have other comments on that.
Yeah, I think, again, the first surge, there was a lot of fear and anxiety because of what we didn't know about the virus. And Now we certainly know a lot more about the virus. We know a lot more about the clinical course of the virus. But I think one of the largest things that we're dealing with now is to what this whole conversation has been about. This is the fourth surge. So many of these people now have already done this 3 times, been pulled from their regular jobs to do something else. Like Warner said, this is not what they signed up for. And again, many of them are willing to do this, but that sense of having to do this one more time, and many of them feel like, as we've talked about, this is a pandemic of the unvaccinated, and so there is a fatigue factor of continuing to go to those COVID units that people are a little less willing to. And so it is difficult, but continuing, a lot of people, it's continuing to step up, knowing that our communities need them, that we've got lots of patients that need the care, but it is mentally and emotionally taxing to be doing this the 4th time.
Yeah. And, we have to balance, we don't want to lose these folks and have them go elsewhere, or because nurses, respiratory therapists, all these folks, they can go and work anywhere now. So you've got to balance and motivate people and encourage them to make this change, versus, well, you just got to go do it, because they'll decide to go someplace else. And so we really got to be mindful about how we handle this with our staff. We're doing a lot of communication. We're having several open forums a week with all of our team members across the system. We've upped our communication. We have 2 system calls a day that are COVID calls to make sure we stay on top of what's happening across our system, redeploy resources, know what's happening. So, we're in kind of our full mode of in our system of how we deal with, a disaster or an urgent situation. And that's really kind of how we're operating today. So it's a different mode. We're doing this touch base twice a day, and we're constantly looking at staffing, redeployment, where do we put patients, how do we think about the continued escalation of patients coming to us in the next 1, 2, 3 weeks. So
okay, I think we've got a clinical question. So Warner, if it's okay with you, I'm going to ask Dr. Hart, Dr. Baumgarten, and Dr. Kimmerly if we are seeing an uptick in the use of ECMO.
Yes, we've done a little bit more ECMO on our patients, looking at that. Unfortunately, this is one of those that there's only a few places that do ECMO. This is back on what Warner mentioned earlier about taking transfers in. We've had to turn away some transfers. I don't know specifically if those were ECMO patients, but this is a service that someone might potentially be transferred in to get. And if we don't have beds, we don't have beds. Very, very unfortunate, but there has been some increase in ECMO.
Okay, we received another question. Has there been any change to whether you'll implement a vaccine mandate for staff now that other hospital systems in the state have done so?
No, we have no change in kind of our policy on this. We will mandate the vaccine when it comes off the EUA. In the interim, folks that choose to be unvaccinated, as I said, will wear an N95 mask and be tested weekly. So that has not changed. We've heard some rumors that the EUA could be weeks away, or the EUA being lifted could be weeks away, not months away. So we'll see how that works. But no, I don't anticipate we're changing our position on that issue.
Okay. A few more questions on that front. So who is asked to move to work COVID beds? Are the unvaccinated staff asked to go to those bedsides, or just the vaccinated?
We're asking all of our employees.
Yeah.
Oh, go ahead, Warner.
No, I'm just going to say everyone.
Yeah. Remember, and also let's go back. We are continuing to, whether our employees are vaccinated or unvaccinated. When they're in the patient care setting, we're continuing to follow the CDC guidelines about all of the measures that need to be taken for patient safety.
Okay, just Chris, clarifying some numbers which we shared earlier. 62% of Ochsner employees are fully vaccinated. 67% have started the vaccine series. Another question, does your model show any impact on hospitalizations in the coming weeks from the governor's mask mandate?
So it's too early to tell on that. We are going to watch that carefully in the next, probably 7 to 10 days to see if our COVID hotline and the people that we put on our symptom tracker, our COVID symptom tracker changes. That has been an early indicator previously that we're going to see a downturn in or a plateauing or a downturn in cases. That's usually the first place we see it. We've not seen that yet, so we'll be watching that carefully in the coming days. If that works, we have run a model that shows cases drop relatively significantly. If we're able to change the R naught from where it is about 2.5 right now to 1.25 or 1.5, has a very, very significant impact on the number of patients we see coming to the hospital. So our hope is people will adhere to the mask mandate and people will continue to get vaccinated. Even getting the first vaccine shot gives you some immunity and helps you. So those are things that we hope people will do in the coming days to help us kind of move through this. But we'll be watching those symptom tracker and our calls to our COVID hotline very carefully in the next week.
Yeah, I'll just add, we hate to put that in the model as we project out the next few weeks, because it depends completely on whether the public follows the mask mandate or not. Based on historical data, we would anticipate that wearing the mask will make a difference. But to Warner's point, people have to wear the mask, and so it's too early to see a change, and we really can't model that until the public shows us that they're wearing masks and really making a difference there.
All right, we've got a specific question for Dr. Baumgarten. Do you feel that recovered COVID patients who are not vaccinated have the same immunity as those who are vaccinated?
So, Meg, that's an interesting question, because we were actually talking about this yesterday with our team. Because we are trying to talk through with a lot of people that don't understand why we're still recommending vaccination, even if they've had prior COVID. And we actually reviewed a nice article that talked about the vaccine immunity has a broader range across variants, across COVID variants. And so that vaccine does give a broader range of immunity than perhaps native infection does. So that's one of the reasons we're still recommending the vaccine despite any prior history of COVID. So we want to boost up that immunity. And then if the vaccine provides a broader range, that's a good thing, both now and possibly for future variants. Although, as we know, we don't know for sure, and future variants could become more resistant or not as affected by immunity due to the vaccines. I know that's a complicated answer, but you also asked kind of a complicated question that has some nuances. I'd also like to add that we need people to mask right now. I mean, I still see when I'm out and about that people are not really adhering to the masking mandates when they're indoors. I saw it last night, and we need that to happen now. It's difficult to model, but there are models out there that show what affects COVID is several things: the rate in the community, which we know is high, masking and social distancing, which we know we need to do, but are not doing as rigorously as we did, and vaccination. So those three things really affect and drive what will happen over the next weeks to months. So it's important to emphasize these three things to our community every single day and every chance that we have.
All right.
Yeah. I just think, and I think Meg's, we appreciate the question, and we get this a lot from our employees. Oh, well, I had COVID, and so now I don't need to get vaccinated. Well, number one, if you had COVID last year, you didn't have the COVID Delta variant, so you don't have immunity to that variant. So you need to be getting vaccinated. And as you said, Kathy, even if you had COVID this year, we still ask people to get vaccinated because it just gives you a better immunity. I mean, why wouldn't you? So I think there's, I was watching a little bit of national news this morning, and there was a senator that was saying, it's an unproven vaccine. I mean, 4 billion shots have been given in the world. 345 or 48 million in the United States. So this is the largest clinical trial in the history of medicine. So that just is not true. It's not true, and it's damaging to the fight that we have every day to try to keep people well. Frankly, sometimes you feel like, folks are kind of working against you. We're just trying to take care of people. But when there's a lot of folks out there spreading misinformation, it's very difficult. And it's why we are, out there trying to get the truth in front of people. Because, if folks don't get vaccinated, if they don't mask, what's going to happen is they are going to come to the hospital because they are going to get COVID. It is going to happen. It's just a matter of time, especially given the spread that we see going on today.
So we're at about time. Dr. Hart, Dr. Baumgartner, Dr. Kimmerly, any final comments, as it looks like we've gone through all the questions in the chat today?
I would just add, again, I think our staff are stretched as they continue to take care of these patients. We're continuing to have to think about how we dial back other services, because I think knowing when the mask mandate went into effect, we probably have at least another couple of weeks of increasing COVID census in our hospitals. And so we'll have to manage that. And so get vaccinated. It will be protective. Can't stress enough, those are not the people in general who are winding up in our hospitals sick and are dying. So again, get vaccinated, help protect yourself and everyone around you, please.
Yeah. Well, last comment I make is, and Kathy says this all the time, we have 890 COVID inpatients today, 90% unvaccinated. We have 0 people in the hospital with side effects or issues from the vaccine, 0. So that's the truth. That's the fact of what we have today.
All right.
All right. We'll keep these going, Nicole. Certainly can give a briefing early next week. I do anticipate in the next few days and over the weekend, we're going to continue to see escalation. So if these are helpful, please let Nicole know. If they're not helpful, please let her know, because we can do other things. But if they are helpful, we're happy to keep, having them. So
All right.
hope you have a good day.
Thanks, everybody.